clean ahead of what's expected to be a busy flu season. But should you use soap or hand sanitizer? The debate is real. But now a new study says stick with the sanitizer. Researchers are finding kids who cleaned their hands with sanitizer instead of soap missed fewer days of school, got sick less often, and needed fewer antibiotic prescriptions.
Okay, now joining us to break this all down is our good friend Dr. Matthew Knight of Knight Dermatology Institute. Good morning, my friend. Great to see you. Did you wash your hands?
It's always when I walked up, you know what he did? He went like this. Hey, you, how you doing?
Well, that's because I got a whole bunch of germs down here, and I wanted to show everyone. So normally we walk around, and would you believe we have about 10,000 germs and bacteria on our hands all the time? But when we sneeze or shake hands or eat lunch or go to the bathroom, that can be 20, 30,000 bacteria all over our hands. And this is how infections and respiratory problems happen. And so you have to get it off somehow.
That's what I was going to ask you. So, you know, I've got 3 kids. I carry hand sanitizer in every car, in every purse, in every pouch. Which is best, sanitizer or soap? Because a lot of times, I got to tell you, Dr. Soap's just not easily available. It's not there.
We have 2 options to get these bacteria and germs off your hands. One would be to wash it off with soap and water. The other would be to use hand sanitizers. And this study indicated that for little kids, hand sanitizer may be better. But there's more to the story. And I want to tell you about why both are really important. First off, hand sanitizers are great because they're easy to use and they're easy to carry, but they don't kill all germs. For instance, there's a virus called norovirus, which is the one that makes all the ships turn around and come back. These sanitizers don't do a very good job at killing them. There are other bacteria that can be serious GI infections that these sanitizers don't work that well on. So you can't just rely on this. The problem with hand washing is that most people only wash their hands for about 5 seconds.
How long should you do it?
About 20 seconds. Also, they over-rely on things, technology like antibacterial soaps, thinking that it's going to kill all the bacteria on their hands, when in fact it's not. You have to have good hand washing technique, which we're going to talk about.
All right, well, let's get right into that hand washing technique, because the thing is, especially even for those of us, sometimes I'll go in there, I'll do a quick little 10-second thing, and I'm done. I don't necessarily count.
Well, I think it's 20 seconds, isn't it?
You're saying it should be 20.
You took the words out of my mouth, and so I brought these birthday hats. You know,
should we put those on?
If you want to, I'm going to go ahead and put one on.
Okay.
One, because my 3-year-old Eli is 3 years old today.
Happy birthday, Eli. Do it for Eli.
But also, doctors tell folks to sing the happy birthday song, which you just mentioned, themselves in their head a couple of times while they wash their hands. That's for a good 20 seconds. So when you scrub with your hands, remember, don't overwash, because that can lead to nicks and scratches in the hand that can allow bacteria to come in. But a good 20-second wash is good.
So sing happy birthday while you're washing your hands?
Or the ABC song at one time. And if you ever watch a TV show where doctors are scrubbing their hands, we use these things in the surgical scrub. Well, you'll see doctors start with what? Our fingernails. This is where all the bacteria and grime like to hang out. So don't forget to get under the fingernails and wash that carefully too for 20 good seconds.
So that's if you have the patience and the resources to wash hands.
That's right.
If you don't, are you saying that sanitizer is okay?
Sanitizer is great, and they should be used in conjunction. Now, you got to use sanitizer the right way as well. So a dollop at half a teaspoon is the right amount to use. But hand sanitizers do not kill on contact. I don't know if I opened it or not. You can use this one. They kill as they dry. So you have to let it dry on your hands. And remember, these things don't work well if your hands are dirty or have grime or other things on them. They have to be clean. So let it soak in for a good 20 minutes, and don't rub it on your pants to try to get it off.
I've been guilty of doing that, yes.
Remember, these things kill bacteria as they dry.
Is there a particular type of label we should look for when buying a sanitizer?
And how much alcohol and all that type of stuff?
So you want to look for ingredients that are about 70% ethanol or alcohol. There are non-alcohol based hand sanitizers that don't work as well. In fact, they can breed something called antibiotic resistance. So I recommend the alcohol-based ones at about 70%. And I want to conclude with one take-home point. Don't cover everything in your home with these substances, being afraid that your little one is going to be exposed to something. It's important for young children's immune systems to be exposed to germs and bacteria, not after we use the restroom or we shake hands or sneeze into our hands, but when our everyday activities, you don't have to sterilize everything in your home. So good hand washing technique when your hands are dirty. Use a sanitizer in between times, maybe after you eat or after you use the restroom. It'll make for a good cold and flu season.
Dr. Knight, great information as always.
Really good information. We appreciate it.
Thanks so much for having me.
Find you online?
Knightdermatology.com. I got some coffee.
Knightdermatology.
Knightdermatology.com.
Thanks, sir.
Thanks for having me.